Well, first of all, thanks to you, Mr. Chairman, and the ranking member for holding this hearing and doing it at a time when we want to emphasize foster care during what we call National Foster Care Month. The passage of this Family First Prevention Act was a transformative undertaking for child welfare system. We must continue discussing how to serve vulnerable children and families who are at risk of entering the child welfare system and finding permanency for children in foster care. Dealing with foster care over a long period of time, maybe 25 or 30 years, I found when you ask these kids that go from foster care to foster care home maybe 2 or 3 times a year, what they want permanency. They'd like to have a home and they'd like to have a mom and dad. So, Mr. Reed, the Family First Law places an emphasis on placing children with family or fictive kin when possible and when removal from the home is necessary. However, there are sometimes challenges to identifying family and the kin that we want to put them with. Can you talk about how Indiana prioritizes placing children with families or fictive kin, what that process looks like, and if there's any challenges?
Thank you, Senator Grassley, for the question. And it's a high priority in my state to utilize kinship providers whenever possible, like Ms. Tapizzato talked about. Kids experience less trauma when they are placed with someone who they know and with whom they have a relationship. And that's often the case with kinship providers. In my state, over half of our children upon removal go to a kinship placement. We must find ways to better support those placements so the children don't experience what you've described, which is multiple placement moves as they are growing up. It's really clear in research that placement stability is critical. In fact, the best predictor for how well a child overcomes trauma exposure is the response of their caregiver. We can't give kids multiple responding caregivers and expect them to heal. We need to support the caregivers where we place our children and give them the right resources so the kids can be maintained in their care so they can undertake that healing that's necessary.
For you also, Mr. Reed, I'd like to hear from you about the process of reunifying families when children are placed in family or fictive kin. Can you share how Indiana remains in contact and provides support for children, the caregivers, and the immediate family for purposes of reunification?
Thank you again, Senator, for the question. And we know in our research that if we place with kin, we're able to achieve permanency more often and more quickly in general for our children. They have better placement stability, improved safety, and higher likelihood of achieving permanency. So that's another reason why we should prioritize kinship placements for our youth. Kin can usually work together to help ensure that the needs of their child are met in a permanent way. So again, that's another reason why kinship support should really be invested in and utilized whenever possible.
Okay. And Ms. Jones-Gaston, the final fiscal year 24 appropriation bill for HHS included my provision to direct the Administration for Children and Families to identify evidence-based prevention programs for families that adopted children who are at risk of entering the child welfare system. Could you discuss efforts by your organization to look at evidence-based prevention programs for families with adopted children who need support?
Having been thank you, Senator Grassley. Having been a child welfare director in a couple of jurisdictions, absolutely know that families that have adopted children are oftentimes coming to the child welfare agency in search of services and supports. And so one of the ways that we support families is through the adoption assistance that is available through 4E funding. But also one of the things that we have funded is the center that created a national training institute that works with social workers as well as mental health providers and understanding what the experiences of children who've experienced both foster care and adoption might be going through so that their needs can be met in that way, and working with a number of jurisdictions across the country to be able to provide that opportunity to improve the number of professionals that are available to meet the needs of the children in those families. The other issue is related to wanting to make sure, is very similar to what we've been talking about in regards to prevention, is to ensure that families have access to the supports and services that they need when they need it. And that foster care isn't necessarily the answer to where there's some mystery secret services that exist. So working with our systems across agencies to really think about what is it that families need, what is it that the children they're caring for need, and being able to have people access those things when they need it, where they need it, how they need it, without the really severe intervention that foster care can be.
I want to thank all the witnesses for your testimony and seeing that this act serves the vulnerable people that it was meant to serve. Thank you.
Thank you, Senator Grassley. And I know going back to the days with the late Chairman Hatch, we've been working on these issues for many years. So
We have,
look forward
yes.
to working with you and the ranking member. Okay.